Thank you very much. Okay, fab. So, as I said, my name is Rebecca Thorpe. I'm one of the emergency preparedness managers for London EPRR team within UKHSA. Next slide, please. So, I'll firstly give you a brief overview of what I'm going to be covering in this presentation. So, who are UKHSA? What are the common public health risks in winter, specifically for communities, faith groups, and voluntary sector organisations? UKHSA winter surveillance, so what could London be seeing this winter? How UKHSA are supporting the Londoners, and winter preparedness resources for all of you that you can use. Next slide, please. So who are UK Health Security Agency? We prepare for and respond to infectious diseases and environmental hazards to keep all of our communities safe. We save lives and we protect livelihoods. We provide scientific and operational leadership, working with local, national and international partners to protect the public's health and build the nation's health security capability. We are an executive agency sponsored by DHSC, which is Department of Health and Social Care, and we were previously Public Health England, which was 2 years ago, which has gone very quickly. Next slide, please. So what are the health effects of winter weather? So from these diagrams, you can see there's an increased risk of high blood pressure, thrombosis, stroke, respiratory diseases and influenza. Falls and injuries and hypothermia are also other direct effects. There is an increase in cold weather-related deaths, which is observed very soon after the onset of cold weather. These mortality rates can remain raised for up to 4 weeks after the initial cold snap. There is strong evidence based on the risks to health from cold weather and about the effects of cold weather on health being predictable and mostly preventable, but mortality is still significantly higher during the winter months in the UK, December to March, when compared to other seasons. The burden of ill health from cold weather and cold homes remains significant in the UK and is a priority for public health and local government action. Next slide, please. Winter can bring specific public health risks for community, faith groups and the voluntary sector. These risks can vary based on geographical location, climate and the severity of the winter season. In addressing these winter-related public health risks, it is important for communities, faith groups and the voluntary sector to work together, collaborate with local public health authorities and take proactive measures to protect vulnerable populations and provide essential service and support during the cold months. So what are the common public health risks in winter for these groups? So for communities, there is prolonged exposure to cold temperature can lead to hypothermia and frostbite, particularly among vulnerable populations such as the elderly, homeless individuals, and those with inadequate heating. In winter, people tend to spend more time indoors, increasing the risk of respiratory infections like the flu, common cold, and COVID-19. Crowded indoor spaces can facilitate the spread of these illnesses. Icy and snowy conditions can lead to an increased number of slip and fall injuries, which can result in fractures, sprains, and other trauma, especially among the elderly. The combination of reduced daylight hours and social isolation during winter can contribute to mental health issues, including seasonal affective disorder and depression. High energy bills constrain household budgets, leading to some individuals or families to reduce their heating or other essential services, potentially impacting their health. Winter can lead to disruptions in the food supply chain and increased cost of heating, which can result in food insecurity for some community members. Winter risks for the faith groups can be things such as faith groups often host indoor religious services and events during the winter, which can increase the risk of spreading infectious diseases, including COVID-19 and the flu. Faith groups play a crucial role in providing social and emotional support. The isolation and mental health impacts of the winter season may be more pronounced, requiring additional supporting outreach. Many faith groups have a higher percentage of elderly members who are at increased risk for cold-related illnesses, making it important to ensure their well-being during the winter months. For voluntary sector organisations, winter risks can be things such as they often face increased demand for their services during the winter months, which can strain their resources. Sustainable funding and resource management are crucial. Voluntary sector organisations may be involved in providing emergency relief or healthcare services during the winter period, which can expose their staff and volunteers to cold-related risks, including frostbite and hypothermia. Effective collaboration with communities is important to identify and address the specific needs and risks that arise during winter. Clear communication and coordination are vital. Voluntary sectors that serve the homeless population face increased demand during winter due to the risk of exposure to harsh weather conditions. Providing shelter, warm clothing, and healthcare services is critical. Next slide, please. So just a quick overview of what this winter could look like, and this is in regards to influenza. So global surveillance indicates that the UK can expect a predominantly a H1N1 influenza season, with vaccine strains being well matched to the circulating virus strains. The baseline scenario for flu is a season equivalent to 2018-19, which is less severe than seeding 22-23, but potentially maybe sustained over a longer period. This is due to the assumption that flu will switch to a strain that is less severe in older people. Next slide, please. And then just covering over what COVID-19 could bring this winter. So genomic surveillance of COVID-19 strains will continue to inform guidance on infection control and incident outbreak management. There is high uncertainty around the trajectory and impact of the COVID-19 scenario. The baseline assessment is for an autumn-winter wave of a new variant with some immune escape, but equivalent impact to winter 22-23. For all other hazards, the baseline scenarios produce equivalent impact on the health system to winter 22-23. Next slide, please. So how are UKHSA supporting Londoners this winter? So we are working with local and regional partners to promote uptake of routine immunisations. We are working with the NHS to ensure that flu and COVID-19 vaccinations are offered together where possible. The cold weather alerts are in operation from the 1st of November, and on the 23rd of November, you can attend the mid-year adverse weather and health plan webinar. We are working to embed the legacy and health equity principles and programs within the UKHSA, and we are working closely with communities where vaccine uptake is low to engage support and partnership. Next slide, please. So we have a few winter campaigns that we're working on with various stakeholders and partners, which you'll be able to access, such as the Winter Preparedness Stakeholder Comms Toolkit. We also have the Winter Flu and COVID-19 vaccination programme, Get Winter Strong, and we are due to publish the schools and residential and adult social care settings packs, which are due to be going out this week, and you'll be able to find those on the Gov website. We've also got a great example of what we've been doing with communities, and this is UKHSA and NHS colleagues have done some really focused work with the Haradi community. It includes tips to stay well this winter with considered wording and information directed at the Orthodox community. And then I've got teams who are doing many more things like this, so if you want to find out more information, please do ask. Next slide, please. So along with our campaigns, we are continuously carrying out winter surveillance and winter reporting. So we have the newly public accessible UKHSA infectious disease data dashboard, which launched last month. There's a really handy infographic which is published every Thursday on X, which was formerly Twitter, and that's a weekly winter briefing giving you an overview of COVID-19 surveillance, and there's a really good little diagram there that you can have a look at, and that's every Thursday. And there is a national surveillance report on flu and COVID-19, and there's a link on this slides which you can use, and that will help with your winter planning. Next slide, please. So these couple of slides, we have pulled together some really useful information, resources, and links to help support you with your planning for the winter. So there's lots of easy to access plans, slides, webinars, recordings, and that will give you guidance, supports, and campaigns to help you get winter prepared. And then in the next slide is secondary, lots of resources. So you've got the cold weather action cards and specifically voluntary and community sector organisations. And there's also some downloadable summary posters, and there's some other links that may be of use to you. Next slide, please. So in order to mitigate these winter public health risks, it is essential for individuals, communities, and governments to take proactive measures. So what can you do? You can encourage vaccination against COVID-19, flu, and other preventable diseases, considering your audience, languages, and terminologies, as you already do. Offer information and support to mental health concerns and isolations related to winter. Promote proper cold weather clothing and shelter for vulnerable populations. Emphasize the importance of maintaining indoor air quality and safety, especially when using alternative heating sources. Promote safe driving and walking in winter conditions. Educate London on winter preparedness and safety measures, and be clear with communication and coordination. We all play a crucial role in raising awareness, providing resources, and responding to winter-related health challenges within London communities, faith groups, and volunteer sector organisations. And the last slide is just a summary of everything I've covered. And if you do have any questions, I can answer what I can later on in the workshop, and you do feel free to email me. And thank you for listening.